And knowledge is power. Did you know that mammograms and routine cancer screenings decreased by up to 92% during the COVID-19 pandemic? Well, now we actually are talking to someone to help discuss the importance of cancer screenings and new technology that can help women get a more accurate mammogram. This is Dr. Randy Hicks. Well, thank you so much for joining us, Doctor. And I have to ask, how has the COVID-19 pandemic impacted cancer screenings?
Yeah, well, it's had a significant influence on us right at the very beginning of the pandemic. At the height of it, it was a disaster in that up to 92% of women kind of avoided screening because they didn't want to come into centers where they might be exposed to the virus. I'm in Michigan, and here in Michigan, I have 9 imaging centers on the east side of the Lower Peninsula. We shut those down for about 9.5 weeks to screening because we just couldn't have women in the same arena as we did have sick patients around too. So it's been a significant problem. However, with vaccines, they're now coming back on board. Women are starting to get screened, and now we've got kind of another problem, and that is we have this huge drastic increase in workload for radiologists.
Okay, so then how are clinicians actually using AI, artificial intelligence, to manage a surge of women that need to be screened this year?
Yeah, so artificial intelligence is really coming to the rescue, and here at Regional Medical Imaging, we use a product called Profound AI. And Profound AI was the first software of its kind to be FDA approved. Profound AI uses the latest in artificial intelligence and is clinically proven to help us as radiologists increase our abilities to read faster by about 50%. So we interpret mammograms at about a 50% increase in our speed, and also decreases our false positive rates. Those are those things that we call you back and say, we think we see something on your mammogram, but it turns out there's nothing there. So it decreases that by about 7%. It does all this by the software itself analyzing each image in those 200, 300, 400 images per woman that are obtained in a 3D mammogram. It analyzes each of those images with its sole purpose of detecting cancer. That's what its job is. It then provides that data back to us as radiologists as we interpret the mammogram, and talks to us or shows us things like particular finding scores or perhaps case scores where it finds things, and this finding represents the algorithm's confidence that there's actually a cancer there. And this information we use as radiologists to read faster, more efficiently, more accurately, and I think gives us a better opportunity to find your breast cancer. So Profound AI really has, increased our efficiency and has paid for itself just in that alone.
Well, this is so important, and this is fascinating as well. So where can we go to get more information, Doctor?
So to get information, you can go to www.icadmed.com. That's ICADmed.com.
All right, Doctor, thank you so much for joining us, and thank you for the work that you're doing to keep women healthy and safe. We appreciate you.
Thank you.